Perfect. So welcome everybody. Thank you so much for being here today. This is the third of our In Treatment webinar series, with one more to follow next month with Ciara Kennedy, who is a CNS in Crumlin, CHI, and myself. And that will be looking around communications with family and with staff. And today, we also had in the past Debbie Cullinan, play therapist, who joined us to talk about parent strategies for siblings and for patients. And now today we're going to focus on you. So thank you so much for turning up today, because I know sometimes we can put ourselves to the last item on the list, and we don't always get to the last item. So I'm glad to see you turning up for yourself today. And I'm Mairead, and probably met most of you, but I'm the principal clinical psychologist here in Childhood Cancer Ireland. So without further ado, what I really want to talk about today is self-care. What does it mean? Because it can seem such an abstract concept. And I really want to help you to understand the importance of it for yourself, that it isn't something that is a luxury. It's something that we need to put in place to sustain ourselves and to sustain yourself through treatment. And really want to make it small steps. So something small. I don't want you to feel that it's giving you more to-dos and another load to carry. It is something that hopefully today, by the end of the webinar, that you'll be able to say, that's small, that's manageable. I'm already doing a lot, or doing little bits. And I'm going to, maybe there's one little thing more that I can add, just something that feels realistic and achievable for myself. And then I'm going to talk a tiny little bit about some of the supports that we have and give space for questions and answers. So to name just some of the services that we have that you might be familiar with, that we have services that are emotional, psychological and practical supports for all family members, both during and after treatment. And I suppose we really understand that everyone may have unique needs, and that might be everybody within the family may have unique needs and have different needs at different times. So each of these different supports hope to attend to the individual needs of each family member. So you'll see at the universal level, we have psychoeducation, which is one of our webinars today. We've got our peer support program, our monthly coffee mornings, our gold ribbon podcasts that are always available to you, parent advice from Debbie Cullinan, our play therapist, beads of courage for patients and siblings, psychoeducation workshops, like our parent workshops that are coming up now. There's another one in Dublin next month. These are for parents who are coming towards the end of treatment or post-treatment. And then financial advice. At a targeted, that's only some of our supports. We're growing the whole time, so lots of new supports coming online as well. We have our targeted level of supports of individual play therapy, psychotherapy with play therapists, and also individual psychological supports with myself. And then at a clinical level, if anyone has additional needs, we look at supporting them, but also linking them into various other supports that may be available to them. So what does self-care mean? It can always feel so abstract and something that is a huge luxury. And as someone said to me one time, almost like I imagine fluffy pillows and lovely candles and just that space to really, and the word that's used a lot, bandied around a lot, is being mindful or being grounded. And I suppose that can feel like such something that's not achievable right now for you when you're juggling all the needs of all family members, including your little one that's going through treatment. And it can really look like that's those stones on the left-hand side, that's what we're striving for. When really you feel more like the picture on the right, that is just got loads of different things that you're juggling, loads of different stones, loads of different stresses that are there, and you're just trying to keep them all together. So what I would say is, it's just seeing where you're at, that if you're on the right-hand side, that it is about, is there any way that we can look at lessening that a little bit more, or making sure that your battery is charged so that you can juggle all those different demands. So small, tiny steps that I'm going to talk about a little bit later. So I often hear mums or dads talking about, I just don't have time. I'll look after myself later. I just don't know what self-care means. I can't. Something else I have to do. So another thing that I have to do on top of everything else and just feels absolutely too much. Or that I'm fine. So I suppose it's just keep you going often through treatment. Parents will talk about just going into automatic pilot. And so they're just keeping going, holding their breath until treatment is over and they can take their foot off the pedal. And I suppose I just want to try and help you understand that there's small little things that you can do to help support yourself while supporting everybody else. So our automatic nervous system, our stress response system, is made up of two particular responses. First of all, we have our sympathetic response, which is our fight or flight. And that's when stress happens. And then we go into that fight or flight automatic pilot where we go into action. And often parents will talk about being in that doing mode at that stage, keeping the head down, keeping going, and not having time to stop and think. I'm wondering if they stop and think, will they feel too much? And they just don't have time to do that right then. And I suppose if you consider our battery, our bodies, like a battery, we are like a car or like our phones. They'll go for a certain length of time, but we do have to stop and charge them. And if we don't do that stop and recharging, they don't always work properly. So no more than our car. If our car ran out of diesel or petrol or electric, we wouldn't give out to the car. We'd understand it. We know we have to recharge it. So we go about the business of recharging, and then we know that we can go on our way again. So sometimes when it's ourselves, we almost ignore that. We kind of go, no, we have to push through. We have to go through. We can't stop. But that's not how our body works best. So I suppose that parasympathetic response is the rest and digest, the recharge that gets us ready to maintain the fight or flight sympathetic response. So what happens if we're kind of running on empty is that we might have poor sleep or broken sleep. We might have poor appetite, poor diet, because naturally when we're feeling a little bit stressed or not having time, the variety of our diet might be compromised. And we might have digestive issues. We might be digesting well. We might have some irritable bowel. There's lots of different things that can disrupt us. We might become hypervigilant or restless, find it hard to rest because our system is in that fight or flight. And so it's not coming down out of its threat response system. We might have a busy mind because if we've got a busy body and we're in that fight or flight, we go into the hypervigilance where we're really hyper-focused, looking out from an evolutionary point of view, almost like our ancestors did as cavemen. Once they realized that there might be a bear or there might be a dinosaur nearby, their fight or flight system kicked in, and then they kept hypervigilant to make sure that there was no threats on the horizon. So our busy mind keeps us busy looking for those threats. So it's not our fault, it's what our mind naturally does when our stress response system was turned on. And naturally, just alluding to that battery, if that stress response system is on all the time, it means that it's running on overdrive. So it's going to empty out our battery. And so that's where fatigue comes in. We also, because of all those variables, may have emotional variability. We might feel numb, or we might feel a little bit overwhelmed. So those waves of feeling overwhelmed, or feeling sad, or feeling numb may occur more often for us. And we're going to be self-critical, because that's one thing as well that happens when that sympathetic nervous system is powered on. Our critical self is trying to keep us safe. So it's like, don't do this, you're doing this wrong. It's trying to control us a little bit to help us to survive. So it can be really, really powerful, really, really loud, and something that we've just to be very, very gentle and mindful with for ourselves, being aware of. So I'm asking you, what is your battery power? Where do you feel you are? Are you recharged? Do you take time to recharge? Or are you like the final battery, just running on empty all the time? And it's really unique to us, knowing the things that recharge us and knowing the things that deplete us. And giving a little bit is all I'm asking, a little bit of time, even if it's 5 minutes at a time, to recharge. And so that's engaging the parasympathetic nervous system, which is our rest and digest. So instead of thinking, I don't have time now, I'll do it later, I can't put me first, all those different things, it may be helpful to see it from this different perspective. That by giving time to recharge, which is the self-care, can help you to care for everybody else. So you're better able to mind everybody else if you're charged. And we use an oxygen mask analogy of, like, even on the airplanes, they say if the oxygen mask drops, put on yours first, so then you can look after everybody else. So I suppose it is looking at what are those moments, just moments, that you can take to put your oxygen mask on and to take a breath. And again, that's going to stimulate your parasympathetic nervous system, that rest and digest and recharge part of your system. So what does looking after yourself look like? That is completely individual to you. And I put the last bullet point to start with one small tweak, and I probably should have put that first. That it's not that you have to do all these things and that you have to give out to yourself that you're not doing them right. It's about starting with one small little tweak that might fit with you. And you know what are the things that work for you to recharge. So is there any way of connecting with them right now in a tiny way? So, and I'll go into some of these in a little bit more detail in the next few slides, particularly the sleep and diet and fresh air. So those are fundamentals. There's 4 fundamentals to our well-being, and that would be sleep, diet, fresh air and movement. I'm not going to say exercise, movement, and supports. So our own social supports that we have. So self-care is about being self-compassionate. Be patient with yourself. Learning to turn down that self-critical voice that naturally gets really amplified when our stress system is turned on. So it's just to be careful with that, because how are you speaking to yourself? Are you being critical all the time? Are you noticing times you're critical? Because that critical voice, if it's turned up way loud, is not a friend of yours. It's not someone that you would allow to speak that way to anybody else, but you may be speaking that way to yourself. So it is about, softening it a little bit or turning it down. And maybe just by having even a very simple phrase that you use, such as, look, I'm doing my best. Even if it's not going well for me right now, I don't feel I'm doing well, I'm doing my best. Connecting with others. What ways can you connect with others? And others that are helpful. You might have some people who are giving you advice that it's just not what you need right now. So it is knowing who the right people in your social sphere that are good for you right now. So that you're really leaning into those, but also allowing yourselves to lean away from others that you might feel are just not suiting you right now. Asking for help is really important. And I think sometimes we can kind of feel that if we do ask for help, that we might lose our independence, that I can do it, so I won't ask for someone else to do it. But it's not about your capacity, your ability to do it, but it's your capacity to do it right then. So what little things can you ask, practical things that you can ask of others that might be helpful? And that might be something as simple as making sure that your other children may be picked up from different sports, different activities. That a neighbour might cut your grass. That that you have someone pick you up essentials at the supermarket. That you might ask people to to make frozen dinners so that you can put them in the freezer for later. So small little things that might be practical for you. Trust yourself and trust your body and what you need. So if you do have a moment that you need to take a rest, that you have the time and capacity, your little one's doing well at that particular time, that you allow yourself to nap, that you allow yourself to disconnect from social media, that you allow yourself to ask for someone to sit with your little ones while you go for a walk. Are there little things that you can trust yourself that this is what I need right now, and can I ask for it? Creating a routine. Routine is so important, and it can be very little things, because I'm even conscious of, if you're in hospital, what little routine can you put in place for yourself? Is it that that you even have a hospital bag for you that has all your essentials that you need, whether it be books, whether it be hand cream, whether it be little snacks, nuts if you're not allergic to nuts, chocolate, apples, bananas. What are the little things that you can have for yourself? Because you're going to think of your hospital bag for your little one, but what about for you? Are there little things that would be helpful to have while you're there to help you create some type of routine and structure for yourself? Connecting with activities that were or are meaningful for you, if possible. Again, it's not about making it another task that you have to do that's burdensome. But if you're someone that used to go to the gym, and it would be ideal if you could go right now, but if you can't, can you give yourself 10 minutes where you can have a walk or out in the fresh air? So little things. So, not exactly the way you used to do it, if possible, if you can't, but little small steps towards giving a little bit of time to it. Breaks from social media can be helpful just to bring down our stress response system. I know it can be a lovely way of maybe tuning out when we need a break, but I suppose there's also a lot of evidence that will tell us that it's just bombarding our brainwave activity. And so if we've already got almost a hypervigilant, busy mind, it's actually possibly increasing that a little bit more and give us another kind of micro dose of stress on top of maybe all the other things we're carrying. I also already mentioned the hospital bag, and I also already mentioned starting with something small, a small little tweak that might work for you. So one of the pillars being sleep. It's a passive activity that we often take for granted. It's something that for our little ones, we become very aware when they're young that we need to put sleep hygiene in place. And we also see the benefit of good sleep for them, and that need to wind down to sleep. That's what sleep hygiene is, that wind down to sleep that we can do to make sure that we have quality as well as quantity of sleep. But we somehow forget as we grow older that we still need to maintain a sleep hygiene to help promote good sleep. And right now in particular, when your stress response system is turned on, That's one of the first things that can be compromised. So it's how that you put little things in place that can help you to re-regulate your sleep if it is poor, or giving yourself good sleep hygiene so that you can do your wind down to sleep and also improve your quality of sleep. So no more than children, routine is key, that we do the same steps every night, that we're consistent, we try and go to bed at the same time every night, that we make sure that it's not busyness until we go to bed, that we take that time to unwind. You know, is it when the little ones are in bed that you're then running around trying to do all the tasks around the house? Or is there times where you can say to yourself, I'm going to take it a little bit slower. I'm going to not do that this evening. I'm going to really see the value of that slowing down, because we can't expect our body to be going at, and our minds to be going at 100 miles per hour and then lie in the bed and for it to go down to zero. That's absolutely impossible and unfair ask of ourselves. So it is about that slow and steady routine that is going to help us to wind down before we go to sleep, so that our body is actually primed, that we are going down into sleep, into lower brainwave activity, by all those different slowing down, pacing activities that we're doing as we come closer to bedtime. And that can be as simple as those little anchors that are telling our body that it's bedtime. Might be brushing our teeth, going for a shower, reading a book, whatever those little things that we can do. Environment is key. What is our bedroom like? Is it dark? Is it bright? Is it noisy? Is it warm? Cold? What is right for us? So getting the right environment. Is it a messy bedroom? That's fine. If you're someone that messiness, it regulates your system, but if you're someone that messiness causes your system to escalate, then it's to know what works best for you. But don't underestimate the importance of your environment. Caffeine is another one of those that is really challenges our sleep. May not affect our ability to fall asleep, but it can break up our sleep and break the quality of the sleep during the night. So it was fine when we were younger, but as we get a little bit older, caffeine can definitely keep us up at night. So, but it's knowing what's right for you and your body and what works for you. I suppose caffeine does have a half-life. So 8 hours after taking a cup of coffee, we're only halfway through the caffeine and the impact of the coffee. So it's just to be aware of that. Eat early if possible, just because it allows our system to have that time during the night where it's not busy digesting. If we eat too early or late before bed, it can actually just put an awful lot of pressure on our digestive system when that time is really supposed to be restorative time. Digital detox. So again, giving ourselves a break from social media, because it's thinking of the way that our brain activity is activated by digital use. And then if we're expecting our bodies and our brains to come to a complete stop and go down into lower brain activity to get good quality sleep, then we can't expect to go from 100 to 0 in a minute or two. So it is about giving yourself that space during the evening to detox digitally as well, as a means of pacing yourself and gently bring your body back into sleep mode. That busy mind can happen either at bedtime or it can happen when you wake up through the night. So at different time points during the night, we naturally wake up. It's almost like waves of deep sleep or REM sleep and then light sleep. So that could be the 1 and 3 a.m. in the morning, and 6 a.m., where or thereabout. It can be different for each of us. That we're just below awake, but if our mind is primed to be busy, we'll wake up and we'll start going into thinking. And as we go into thinking, our body gets restless and it's even harder to disconnect from that and go back to sleep. So it's about, if we're finding that our mind is busy when we wake up, It's almost happening automatically. So can we find a way of focusing on something else to keep us away from overthinking, going into thinking, going into worries, where our mind is so busy and active? And that's where mindfulness activities can come in. It is a way of keeping our focus on one thing that feels relaxing, rather than going into all the thoughts and worries that might take a lot of active brainwave activity. And the one that we were probably taught even as we were very young was counting sheep. When we imagine ourselves counting sheep, even though we possibly wasn't described to us, we presumed that they were going to be slow and rhythmic, jumping over fences. And so it gave us a visual that was quiet, was calm, was easy, that could keep our mind focused. And that's exactly a mindfulness activity. It's just keeping our brain a particular focus that's calming and relaxing. And you might know other ones. You might use body scans. You might use breathing exercises or visualization techniques. Whatever works for you. And sometimes people find that, it's getting up and reading a book. Something that's not too stimulating that might help. But really what we're trying to do is break that tendency to go into high alert mode and busy mind when we naturally wake up during those different cycles during the night. To refuel and recharge, nutrition is possible. And it's not about getting a perfect diet. That would be impossible ask of you right now. And anyway, if your stress system is turned on, your body is primed to want those quick and easy snacks that may not be full of, rich in nutrition. That's the way our body is primed. But make it something that's small and manageable for you. If you don't have a great appetite, the importance of grazing, and that's where the little snacks really come in to have at hand that you can nibble on, whether it's in the car, whether it's in, the hospital, if it's in your bag, those little snacks in hand that make it easy. And that can be, as I said, nuts, it can be hummus, it can be fruit, anything like that, or chocolate. That can be something that you can grab and that can be nutritional dense. The balance of nutrition is important, as I said. Can I get a little, if you're now at the moment you find it hard to get anything in terms of a meal, could you one meal a day give yourself time to think about, to have maybe something in the freezer that can be accessed, something that feels achievable. Asking family and friends to provide those is very important, because don't underestimate the importance of getting that good fuel to sustain yourself right now. And can you get your groceries delivered rather than having to go to the store? Or maybe it's click and collect. Are there ways of making it manageable for you right now and just reduce demands on you? Movement, and I never say exercise because sometimes it's not possible to do, or something you want to do at a particular time. Movement, just having movement for yourself is really important. And again, I'm conscious of if you're in the hospital and staying overnight, can you take those little gentle stretches for yourself? Small little stretches that, you can do in a chair, you can do on the floor if you have a towel at hand, anything that can give you those gentle movements. It's just a way of releasing tension in our body. And again, it can be something that can recharge us. So small and simple. Fresh air if possible. Doesn't have to be a big run or, an hour in a gym. Can you get out in the fresh air even for 5 minutes? Again, can you ask family and friends to step in so that you can do those things? Sometimes I hear people saying, they just don't want to ask. Family are being so good to them and friends are being so good. They don't want to ask for something for them. That how can I possibly go off for that walk and ask them to step in again? How can I ask them to step in while I go to the gym because I really love going to the gym? You can ask. this is a moment in time. And there's times where they'll be there, you'll be there for them as well. So it is about realizing that you don't have a certain amount of credits that you can ask them. But if it makes you feel a little bit more reassured that it's not too much to ask, it's always a good thing to say to them, look, I want you to be able to tell me if it's too much. So, and that's okay. So that you have that open communication around what you can ask and knowing that they'll be able to provide it. Don't underestimate bubble baths and showers. Just those small moments for yourself that might feel that you just don't have time for now. Again, it's looking after your body. It's helping to regulate and connect you with your parasympathetic nervous system. So again, it's about sustaining yourself and recharging yourself. And there's a lot of body therapies now that are provided through the likes of different cancer support centres around the country. So one local to you might offer, massage therapy, reflexology for parents. So, it is worth exploring if it's something that you may feel that might be helpful for you or something that you enjoy and have time to do. And I suppose all the cancer support centres would say, when you're making an appointment, you may not, things may change as it comes close and you may not be able to attend. So they're well used to that and they completely understand that. So you can always just let them know last minute you won't be able to attend. So what I would say is put them in the diary if possible, and you can always move them again. So just to give you a picture of some of the supports that we have. So for the young patient, there's access to psychotherapy or play therapy. For adolescents and young adults in shared care at hospitals, there's hospital refurbishments, there's community events, and there's the individual psychological support. For siblings, there's education webinars, access to psychotherapy or play therapy, individual psychological support for older siblings. They have access to podcasts, to community events. And then for parents, there's parent workshops, both at end of treatment or if you're in the maintenance phase of treatment or post-treatment. Individual psychological support, again, podcasts and community events or coffee mornings, peer support, advocacy, or financial advice services, and educational webinars. And I suppose some of our educational webinars that we focus on so far would be around the CAO application for Leaving Cert students for third level education, or the DARE application, different pathways to further education. So not just through the CAO, but different pathways that are available for our patients. We also have the Institute of Education Grinds that's available to patients that runs throughout the year. And starting in September, we're going to have a career guidance panel of counsellors who will have a one-to-one with parents and Leaving Cert students and fifth-year students to explore maybe their options for career. So now that's the end of my slide. I'm going to give you time to ask some questions and answers that you can pop into the chat. And just my email address is there. So anytime, just reach out. Any questions, just ask. I may not have the answer, but if I don't, I'll go about finding out and I'll come back to you. Thank you. So let me